Hi. Say hi. Hi, and welcome back to Phoenix's channel. Okay, so today our vlog will be about our visit to the dentist. So we're going to be heading to the dental surgeon to get some teeth removed. So, backstory of that is that while we were in Jamaica, she had an unfortunate incident where she fell while in her wheelchair onto a concrete surface, face first. So she suffered some bruises to her forehead, side of her head, and the biggest one was that she knocked this tooth and this tooth. Those got fractured and they have to be removed because they've got pointy edges that are giving her some trouble. So that's what we're going to the dental surgeon today to have done. Now, a little backstory. So while we were in Jamaica and this little accident happened, we had to take her to the children's hospital that was there. It was about 8 p.m. at night when we got there, and that, let me tell you, was a whole crazy story. So when we got there, very quickly, she was bleeding everywhere. I had her in my arms. It was a very scary time, as you could tell, for any mother. And then, so we went in, they rushed us right into triage area. We got to go see the first doctor. She assessed her, which was like more of just look at her and ask me questions of how she felt. And then ordered us to do a x-ray. So we went, we got the x-ray done. It was like really quickly. They even apologized for how long it took, which for me it took like half hour. So it wasn't very long. And knowing that it is a public hospital, I thought it would be much longer. So anyway, we got through that part, came back around, and that's when they had us register. They gave her Panadol for the pain, and they had us register and everything. And at this point, we were just waiting for the results from the x-ray that was done. That took 3 hours. 3 hours standing, waiting for a doctor to come read the x-ray and tell us what the result was. Crazy. And we are talking about the only children's hospital on the island. We are talking about the #1 children's hospital on the island. We're talking about Bustamante Children's Hospital in Kingston. So anyway, we got finally got to go back and see the doctor after about 3 hours of waiting. She read the results and the results were inconclusive for her, so she wasn't sure. Now what she wasn't sure about was that there was something on the x-ray that was unusual in the nostril, in the nose area. Now, for Phoenix Marshall-Smith syndrome, most of the issues come with the bones. They're irregularly formed. They are just not your typical bone structure. And I did explain that to her, right? Now, what she wasn't sure about is that if she had seen a fracture on the nose bone or if the fracture was on the skull area that was there, which is definitely cause for concern. Definitely. So then she went ahead and she said, well, I'm going to refer you to somebody else. I'm going to refer you to an ENT maxillofacial person, and they can get us a better answer. So she sent us to the ward so you can go see these specialists and they can determine if this x-ray is showing us something more serious. What's up? You want to lay down? Phoenix is, of course, grumpy because she is on fast for this surgery, so poor baby hasn't had anything to eat. So anyway, they sent us up to the ward and someone came to me, examined Phoenix, took like pulse ox results and stuff, and then he went and sat down with his phone watching videos. So I'm looking at this guy and I remember turning to him and I asked him, which of the specialists are you? He replied, oh, I'm a nurse. This guy replied, oh, I'm a nurse, and sat down and went right back to his video. It's like, okay, all right. So I waited a little bit. Another nurse asked him a question about another patient that was there, also waiting to see this doctor, and he just replied, oh, no, I didn't call the doctor yet. So anyway, long story short, cutting from there, finally about an hour or so of waiting, so we're now around in the 2:30, 3 o'clock in the morning time frame, and finally I saw, like, where I was sitting, there was like a dark area in front of me, like a dark covered area. There were like white uniforms coming out of every little section in there. I was like, what's going on? So when all the uniforms were coming out, I noticed it was all nurses, and they were all sleeping back there. So they were all like shuffling up, fixing themselves. I mean, like, there were only 2 nurses on this entire ward area. I mean, a ward that is full of kids crying in the middle of the night. And these people were coming out of these little tunnels, like 5 or 6 of them. So you, like, for example, if there's like 7 people on shift, there's only 2 working at this time of the night, and everybody else was fast asleep. So everybody was shuffling out, coming out, and finally I noticed that these 2 ladies walked in. They were in their scrubs and stuff, and I realized, okay, so these all nurses were all shuffling around because they heard that the doctors were coming. Finally, all the babies that were crying got all the attention that they needed. They were quiet and fast asleep now. So anyway, the doctor came. One of the doctors came to me, really nice lady. She was the first one, and I'm talking about like 2:30, 3 o'clock in the morning, that finally gave Phoenix a full look over. Like, she, how in first aid you were taught to rub the head, touch, feel to see if there's any bumps and anything like that. She was the one that finally did all of that. She was the one that finally lifted up her lip and showed me that there was a laceration to her gum area that was about 2 millimeters deep, 2 millimeters wide. So I was like, okay. Only to find out this woman at the end of the examination, she wasn't even supposed to see her. She was a neurosurgeon. The other doctor that had come in was a general surgeon. Remember who I said I was supposed to see? Maxillofacial and ENT. They're like, I don't know why you're here. I don't know why we have to see her. She's clear on our end. What you do need to see, though, is an ENT and a maxillofacial person. I was like, I thought that's who I was coming here to see. They're like, no, they're not here. This is not their place. I was like, are you kidding me? So at this point, I'm losing my mind. At this point, I'm crying. Baby's on my shoulder sleeping, and I am just crying. I'm losing my mind. First of all, you can't have anybody else in there with you. So at this point, my father had brought home, well, before this, my father had brought home Carlin, who had CJ, and my nephew, and a couple other people that were with us. So leaving behind was my sister, my brother-in-law, my niece, and my nephew. And yeah, that was it. And so they were in the vehicle sleeping because they can't come inside the hospital with us. So anyway, I'm crying because I'm like, this is crazy. It's like 3 o'clock in the morning. All she's gotten is Panadol. Nobody has gotten to see if this crack in her skull is a serious issue. Nobody has really examined the kid for a concussion except this one doctor at 3 o'clock in the morning. So then she says to me, okay, but I don't know when you're going to see the ENT or maxillofacial because they're going to be leaving from wherever to come here. I was like, you have no approximate time at all. She's like, no, I'm going to send you back down to the emergency department. She sends me back down to the emergency department. I call my sister on the phone. I'm like, listen, I can't deal with this. I'm losing my mind. Nobody knows what to do with my child. It's like everybody is all interested in her syndrome, and not in a good way. It's like in a sensitive way. Like, she was being called Marshall Smith syndrome kid. She no longer had a name. It was no longer Phoenix. It was the Marshall Smith syndrome kid. I don't like that. She was it was like, oh, but look at the skull area. They were looking at the shape of her head. They were looking at things that did not pertain to the injury that we're trying to figure out. Did she fracture her nose or did she break her skull area? That's what we're trying to figure out. Is her teeth breaking a serious damage, or is it something that can be left? That's what we're trying to figure out. But these people were looking at her like a science project, like, oh my god, this is so amazing. I don't mind spreading. I love spreading about Marshall Smith syndrome. Every opportunity I get, I talk about my daughter. But not like this. No. So anyway, my sister meet me down by the emergency department. We get down there and the security was like trying to stop her. I was like, just let her come. We go back there. They are like, how can we help you? Yeah, I lost it. I cussed everybody out. I cussed everybody and their mother out. Not ashamed of it either. I yelled at everybody. I was screaming. I was crying. I was tired. I was annoyed. This is like 4 a.m. I am just, what on earth? You mean to tell me that there may be a head injury, a serious head injury to a child who came in at 8 p.m. and at 4 a.m. still hasn't determined what's going to happen, and I still have to sit here and wait for a couple other people. Thankfully and thank God, there was another doctor that was working down at the triage area. She came to me and she was like, what's going on? I didn't even want to talk to her. I yelled at her and screamed at her. And I told her sorry a million times for yelling at her because, she was trying to help at this point. And so she said, I told them I needed to get the form that said I'm leaving against medical advice because at this point I was like ready to book a flight to come home. I figured as soon as I landed in Miami, I would be able to at least get them to fly her to Milwaukee, or we'll fly the rest of the way, whatever it took. But I needed to get my child home because my country was not helping a kid. They were more interested in her syndrome more than anything else. So anyway, she made a few phone calls and she said to us that by this time it was like the hours were just flying by. It was like 5 a.m. and she finally got me to calm down and listen to her. She said she'd make a couple phone calls, see where the maxillofacial and the ENT were, and she'll try and see if they could come in. She went back, she came around, so she finally said that they'd be here probably in about half hour. So I said, all right, we've been waiting all night. Let's just do this, half hour more. I said to my sister, all right, let's do this. We'll give them 45 minutes to get here. No lie, in about 20 minutes or so, the first doctor came in, and we noticed him because he had his scrubs on and everything, but he looked like he just rolled off the bed to come in. Super helpful, Dr. Wilson. He's actually not a doctor there, but a consultant. And he came in by the grace of God. He came in, got Phoenix looked at. He was the maxillofacial doctor. He got her looked at, checked out her teeth. He said, I'll give you antibiotics, pain relief, all that stuff. So he said he'll give her antibiotics to prevent infection, pain relief, and he thinks she's good to go to wait another week till she can get home and be seen by her regular doctor, which was so good, which is exactly what I wanted to hear. So I was like, all right. Next, the other doctor was already waiting for us by the time we were done with him. Took about a half hour for him to chat with us, reassure us, make us feel better and everything. Then we got in to see the ENT. Security was being crazy about my sister not being able to be there, but I'm not even going into that. They were just trying to do their job and do what they're told. So anyway, we got in to see the ENT. Wonderful lady, very, very nice lady, very interesting person. She bumped up the meds, so she thought, she needed more dosage, not more volume than what the maxillofacial had prescribed, which was fine by us because obviously it worked. We got to leave there around 6:30 thereabouts, which is when the ordeal was finally over. So anyway, while we were there, I noticed, backtrack a little bit, I called the special needs team for Phoenix's hospital, and they did their best to try and call the children's hospital. All they got was a runaround. It's not like they were calling to get information. What they were trying to do was to give them some information on Phoenix, on her bone structure, on her, so that, you know, that might help them in determining if the x-ray was unusual or not. No help. They got the runaround completely. Sent here, there, and nowhere. Horrible. So anyway, so that's what she is having done today. The dental surgery is to have those 2 teeth removed. So yeah. So now we are at the hospital awaiting the pre-op stuff, so she can get started on her surgery. She's still tired, grumpy, hasn't eaten anything, so she's pretty hungry. But we'll see how it all comes together. Her vitals taken and everything else, and we are now waiting for them to take her back. So we'll see. So basically what we just learned is that so the dentist and the anesthesiologist had come in, and they basically had a couple things to say. So the anesthesiologist does not want to perform the surgery, or does not want to be the anesthesiologist on the surgery because of her complicated airway, which I explained to him she has outgrown and has corrected, and, you know, told him all the issues that she has now, which is the far back airway, which is just about it. Her subglottic stenosis had corrected itself already. But the surgeon who is going to perform it, he is fine with performing the surgery. The thing is that then we'll have to move over to another hospital. So we are being transferred over to the other hospital to see if they can do the procedure. The anesthesiologist over there is willing to do it. He said okay, he would try, but if it's not possible, then he's just gonna be done with it, and that's that, which is fair enough, better than them not seeing her at all. So we'll see what. Okay, so we've gotten settled into our new room in the next hospital that they moved us to. She got some apple juice, and the doctor did find an anesthesiologist to help him out this time. So we'll see. So it is about 6:35. Her surgery is still set for an hour from now, so 7:30. So we'll be headed down pretty soon to go get her prepped and ready for surgery. They're on time and got Phoenix back for her surgery, so now we're just in the waiting room waiting for this to be over. They said it shouldn't be longer than about 30 minutes or so, so we'll see how it all goes. So her surgery is over. Surgery was successful. They were able to successfully intubate and remove her teeth. Turns out that it's 4 teeth that needed to be removed. All the front teeth are now gone, so there's that. But the doctor said there shouldn't be any damage to the permanent teeth that would be coming down
So we're just looking to get this kid ready to take home, and then this day will be over.